Victoria Lewis. I am a PCT at Florida Medical Center.
So nice to meet you.
Nice to meet you. I am one of the founding members of the union in the facility. There was no union there, so we got the union started in the facility.
Congratulations.
And it's going well. Thank you for having us here today, and it's my pleasure speaking with you as one of the healthcare champions.
Thank you. The pleasure is mine.
I'm going to ask you a few questions. As a union of healthcare workers, what would you say are the biggest challenges blocking our ability to provide universal access to healthcare in Florida?
Well, that's a no-brainer. It's a sad no-brainer. The fact that we still have no ability to get the Republican majority in this state to vote to expand Medicaid so that we can really make sure that people who are falling in the gap between Medicaid and the subsidies available in the Affordable Care Act are able to get access to affordable coverage is unconscionable. It's unconscionable, it's immoral, and it's something that literally has denied nearly 1 million additional people from being able to get health care here in Florida. In addition to that, when President Trump was elected, he proceeded to attempt to kill the Affordable Care Act either outright by trying to push through Trump Care, which would have completely destroyed the ability to make sure that people have good access to quality, affordable health care. And instead, when that was unsuccessful, he's trying to kill it through death by 1,000 cuts. And so making all kinds of changes that he's able to make within his executive authority because he can't get the changes, the repeal that he'd like to make through the Congress.
You've answered my second question,
Oh.
so I just go on.
No, you can ask it. I'm sure that I can say it in a different way.
What legislative issues are you working on right now, and how will your success impact our constituents for the better?
So I'm working on a number of different pieces of legislation, particularly for a healthcare workers union like SEIU. One of the bills that I'm pursuing, which I most likely will launch in a more significant way in the next Congress, but we're researching it and getting it ready now, is a bill that would focus on life expectancy in the United States. As you probably know, and as your members probably know, we've had life expectancy go down for the last 3 years. Mm-hmm. That is the longest period of time that we've had a decrease in life expectancy since World War I, since when President Wilson was in office. Mm-hmm. We are the greatest, wealthiest country in the entire world, and our life expectancy has gone down. Our maternal mortality rate has gone up. The maternal mortality rate is actually better in some third world countries than it is in the United States. And yet there continue to be a Republican majority that proposes cut after cut to the kinds of investments we need to be able to make to help make sure that we can keep people healthy.
It's so shameful, isn't it?
Shameful. So besides life expectancy, additionally, I'm focused on trying to make sure that we can help domestic violence victims, for example, because we have a really terrible problem in not just our state, but across the country, where oftentimes victims of domestic violence are discriminated against and kicked out of their housing, whether particularly in rental complexes where landlords control, yes, who is able to continue to be a tenant. So it's not the abuser that becomes the victim here, but if you are a repeat victim of domestic violence, yes, there are landlords that kick women especially out of their homes. So I have legislation that I've introduced that would add to the Fair Housing Act a prohibition that would prevent that from happening, just among a couple of bills.
Good.
Lastly, not lastly because there's many more, but the other thing I wanted to highlight is that there is an issue with too many, particularly smaller hotels and motels that are essentially functioning as willing hosts for human traffickers. And there are no consequences. And some of the hotel organizations are, starting to pay attention to this and crack down on it. But I'm looking at filing federal legislation.
On a lighter note, what is it about being a congresswoman that gives you most joy?
Oh, that's such a nice question, and I'm thrilled to answer it. There is nothing better than being out in my community with the people that I represent. Whether it's showing up in a church and sitting with a congregation on a Sunday morning, or rallying the troops, so to speak, our troops that around the issues that we care about. The really horrific experience we just went through with the separation of families at the border, and our community rallied. It was our community where we discovered the homestead facility had been reopened and children separated from their families had been sent there. Our community rallied in protest and helped. I helped lead the way to shine a spotlight on the Trump administration's horrific actions. And so being able to represent a community whose values I share, and to be able to champion those values, and to be able to really spend time with people and hear about their concerns, and then go back to Washington and stand up for those concerns, there's just nothing better than that.
Well, thank you for your time.
You're welcome.
Thank you for your support. The community is one that's behind you. You may not realize, but 1199 has your back.
Thank you. And I have the backs of not only 1199's workers, but workers all across our community. We may be a right-to-work state, but we're going to continue to fight to make sure that working families, working people, are paid the wages that they should be paid, and that we can make sure that people have the ability to live and take care of their families without having to have 2, 3, and 4 jobs to do that.
Again, thank you very much.
Thank you so much, Victoria. Pleasure to be with you.
How did I do?